When I contracted norovirus, I was recovering from a chest infection. I was at a friend's house and we were having dinner, and within half an hour of me eating, I suddenly found myself on the floor vomiting. I was having my bowels open. At that point we didn't know what was the matter with me. An ambulance was called and I was taken into hospital because they had found out that I had had a heart arrhythmia because of the sudden dehydration and shock, I suppose.
I'd gone away to Brighton for the weekend. It was supposed to be a romantic weekend away. Got to Brighton and pretty much as soon as we checked into the place we were staying, I started to feel really quite hot, just got ever so hot, and just felt really unwell, and within sort of 5-10 minutes I was quite violently sick. I wasn't able to eat anything. I was so worried at the time. I thought there was something, desperately wrong with me, and I remember calling whatever the equivalent of 111 was at that time, asking for a bit of advice, and was told that it was likely to be norovirus.
I got a healthcare associated infection in 2007. I was in hospital because of needing some plastics work, and a couple of days or so after the fourth operation I then found that I'd contracted C. diff. I felt horrible, not just because of the infection, but also because of the treatment you get from the infection, because the antibiotics are administered in fairly large doses, so it's a very uncomfortable 3, 4, 5 days.
We have cared for Pop for 8 years, and he's now nearly 101. Sadly, he's now in a home. He refused to wash his hands, and that resulted in him succumbing to infections, blood infections, urine infections.
We had children at school who needed to be kept home because I had been diagnosed with norovirus. My husband lost money because he wasn't able to go to work.
C. diff is undignified and distressing both for the patient and for the healthcare professionals who basically have to clean up afterwards. I
was quite rapidly put into a side room, but they were busy. It was a Saturday night, there were lots of people there, and I was actively being sick.
I have noticed on a ward, and that was due to speed. The person was very rushed, that they didn't wash their hands properly.
I was at the GP surgery on the Friday. I contracted this on the Saturday. There was hand hygiene gels available. Very few people were using it.
Just think of the effect it would have on, say, an elderly patient or a very young patient or someone who's been weakened by long-term illness.
I would encourage people to take good care of themselves, if not for their own sake, then for the sake of others, other people that they might be potentially passing on quite a horrid bug to. It's important that we keep our hands clean.
Please just use the procedures, use the processes, and make sure that we cut the level of infection.
I feel very, very angry and very strongly that people have got a responsibility to not pass this infection on if they've got any influence at all.
As health professionals, you work very hard with your great skills, your care and technology, but a very, very simple procedure that takes less than a minute can benefit your patients hugely. Equally, if you don't do it properly, it can be very adverse for them. So please do that. Because for me, my father is my priority, and as for you, your patients are your priority. So thank you.